Welcome to Dear Sandy. I'm Sandy Galiff, a member of the New York State Assembly, representing parts of Northern Westchester and parts of Putnam County. And today we're going to be talking about some very interesting programs that are occurring within our communities. And it's all about building a healthier community and involving our health agencies, our healthcare system, as well as our educational system. And I think you're going to learn a lot from this program. So I have two special guests with me. Alette Hershaw, who is the Director of Clinical Services and Programs for the Open Door Family Medical Centers. And I guess they're centers because there are many of them. So Alette, we welcome you.
Thank you.
Great
Happy to be here.
Good. And Alice Joslow, who's the chair of the Ossining Communities That Care, and we welcome you. And Alice has been member of school board and president of the Ossining School District, so this is kind of coming back to a new program, which,
on the library
is
board
great.
now too.
And the library board, right. So let's first. What is Open Door? What kind of service does it provide to our communities?
Open Door is a federally qualified health center, and we provide quality primary health care and human services, basically to the underserved. We have a number of community health centers. We have one in Ossining, one in Sleepy Hollow, one in Mankisko, one in Portchester, and our newest community health center is in Brewster.
Right.
And we have five school-based health centers in Portchester. We have a mobile dental van on the road, and we have a large dental service within our walls of our community center.
When you say underserved, what does that mean?
Well, people who don't have insurance or who are underinsured, we provide care at very affordable rates.
In very nice locations.
And very nice locations.
Right, which is great.
And we do it all. I like to say we do it from prenatal to geriatrics. So we have family practice, we have obstetrics, we have our own midwives. We do our deliveries at Phelps in Tarrytown. We have ophthalmology, family practice, ophthalmology, podiatry. So we really do it. Mental health services. We do it all.
Right, it's great.
Yeah.
Alice, you're chairing the Ossining Community Cares Program, which has been, how long has that been in existence now?
Actually, since 2003, and interestingly, the CEO of the Open Door, Lindsay Farrell, it was Lindsay Farrell and I actually who brought it into the community together.
And what does it do? I know people go to meetings and so on. Are you trying to coordinate through the Ossining Community Cares Program all the services from a lot of different agencies and churches and synagogues and everywhere? Is that part of the plan?
Yes. What Ossining Communities That Care does is we actually have a federal grant from SAMHSA, the Substance Abuse and Mental Health Services Administration, at the federal level.
Okay.
And
so that was the thrust of it, to really, get to substance abuse. Is that pretty much how it started?
I think that the funding stream is focused on substance abuse, but the vision has always been focused on positive youth development. And that aligns really well with the mission of the Open Door, which is really health, wellness, and prevention. In the continuum to support people, because if you're not healthy to begin with, you really can't function well in whatever environment you're operating in. So Ossining Communities That Care is focused on substance abuse prevention and positive youth development, specifically for the teenage years. And the grant, the SAMHSA grant, the Drug Free Community Grant, requires that you involve 12 sectors in the community: parents, youth, healthcare, clergy, police, recreation, substance abuse prevention. There's a list of 12. We've been meeting monthly since 2003, and we've brought in a host of prevention services and positive youth development services, and we have actually had some significant outcomes with regard to substance abuse, but I think more importantly, we've really developed an infrastructure of collaboration and cooperation across the community. And that's really the primary focus of the drug-free grants, is to promote collaboration and more efficient planning with regard to a community, as well as reducing substance abuse.
Right.
And that's why the partnership with the Open Door is so critical.
And let's talk about this partnership now. You've started to look, or maybe it's been going on for some time, having healthcare centers within our public schools. I think we're talking about public schools. And you know, this has started, you know, to become something that is very important. I also think it's probably been very difficult to get started. You've been working, I believe, in Portchester.
Well, let me give a little background. There are over 220 school-based health centers in the state of New York. There's about 1,200 in the whole country. And school-based health centers are primary care centers in the schools.
It's not the nurse's office.
It's not the nurse's office. Now, there's a difference. The nurse is so important and works collaboratively with us, and is an important member of the health team in a school-based health center. But it's not the nurse's office. So, Open Door runs and operates school-based health centers in the Portchester School District. And very recently, the Ossining School Board had voted unanimously for Open Door to come in and start school-based health centers in Ossining High School. So we're in the process. We formulated an advisory committee with community members and members of school administration, the school nurses, representatives from the Open Door, and we're actually working on trying to get the license now, because the license comes from the Department of Health.
On the state level.
On the state level. So we're going to be licensed as an Article 28 treatment and diagnostic center. So we will be able to provide primary care services to the students who enroll in the school-based health centers.
Alice, is that a part of the, you know, your vision for the Community That Cares program?
Well, it is, but I actually want to really go back to when I was a school board member. I was a school board member in Ossining from 1999 to 2011 for 12 years. And in the course of my service, we developed 3 long-range plans. And one of the initiatives that we had not gotten to yet was to create something called full-service schools. And Lindsay Farrell, the director of the Open Door, was really very sort of visionary, and she took a risk to start doing that in Portchester. And what she did is really perfected it in one community before she brought it to another community. But it was part of the long-range plan in Ossining since 2000. So we're so fortunate that now we can sort of build upon all the things that went well and some of the stumbling blocks that you hit in Portchester. We're going to hit the ground running in Ossining with all of your knowledge
I think
that you started.
one of the really terrific, I mean, there are so many positive attributes for a community, for a school-based health center, but one is really working on prevention and really turning students, young students, into their own, to being healthcare consumers, to advocate for their own health. I mean, we've seen, we're doing this in Portchester for 12 years already. So
you said you're in, okay, continue, and then we'll go back to, it's in all the schools, right?
It's in 5 schools. So
5
we're in 3
schools.
elementary schools, a middle school, and a high school. So we've actually seen graduating classes,
Oh, okay.
which is wonderful.
Right.
And I think that the students are so much better off educationally, of course, because they miss less school days, and they gain much more seat time. They don't have to miss school. If they're sick, they come down to the health center for a sick visit or an acute care visit. But we're really turning them into being consumers of health prevention. So it's really to see it, it's amazing.
Right.
Can you also explain how it doesn't supplant your physician that you've been
Yes,
using?
yes.
Because some people are they don't understand that.
Right, right. So I guess I'll start from the beginning. In order to be enrolled in a school-based health center, you need parental consent for most things, except for protected care. and protected care are the Minors' Rights Law to reproductive health care, and some mental health as well. But normally a parent must fill out a consent form, and the student can use the school-based health center as a primary care provider, or they can keep their own primary care provider and use us as supplemental care. And our providers in the school-based health center work in conjunction with the family and the primary care provider to really focus on a health care plan for that student.
Now, it's only for the student. It's not for other members of
No,
the
it's
family.
only for the
It is only
student.
for the
Yeah.
student. So, how many continue? Do you think? Do you have any idea what percentage continue with their own doctor and have it as a supplementary in the schools?
You know,
or-
it's been a very interesting experience, because that's something we have to monitor, and we have to monitor for the Department of Health as well. There's a portion of the kids who do maintain their own primary care provider, not a very large percentage, at least that's been our experience in Portchester. But it's so convenient for parents and for kids. They do not need to miss a day of school to come for their physical. So very often parents will really sign on and want to use the school-based health center for their physicals along with other healthcare needs.
So let's talk about the beginning of the year, and I think the goal in OSNI is to have it open for the school year
Yes.
in 2014.
Yes.
How does it all start? So the parent signs the slip giving permission and so on for their child to be part of it. What's the first thing that is looked upon? Is that a physical? Are there requirements that you seek out right away to be sure that they have fulfilled those requirements?
Well, parents must fill out a health history. And we work collaboratively with the nurse as well once the child is enrolled with the school-based health center, and try to get some of her records, at least allergies and immunizations. And so kids could access a school-based health center in different ways. They could access it for their physicals. They could access it for their chronic diseases. We do a lot with care of asthmatics, care of diabetics. Matter of fact, there are studies that show across the nation that a student who has asthma, their ED, and is in a school-based health center, their hospitalizations and ED visits are reduced by 70%. Ours in Portchester are much higher than that. Our statistics are about 90%. So look at
So what's the difference? It's just that
well, the
when
difference is that they're coming to us for maintenance of their chronic disease. They don't need to go to, so they're learning about their asthma. They're getting an asthma action plan. We're doing the necessary tests for them every season, so we know how to monitor what medications they may need for a particular season, if it's allergy season, if it's spring, if it's winter. So we're working with environmental triggers. And those are usually what causes kids or adults to go into acute asthma symptoms when their asthma is not under control.
Yeah. Alice, you've been so involved with working, trying to prevent drug and alcohol abuse and so on. So how does that all fit in? Does it fit into what's happening?
It's
major.
It is such a great opportunity for us. The drug-free community grants come in 2 5-year blocks, and they're actually extremely competitive. And we are in year 9, and there's only 1 year left. So we have, on a regular basis monthly, 20 to 30 people who come to our table, including all the politicians, the police, people from the schools, parents, all the community agencies that serve youth. So we want our efforts to continue, and the challenge for all drug-free communities is what they call sustainability. How are we going to keep our efforts going? And the best partner that you can have for health, wellness, and prevention is a school-based healthcare center. Because the police are still going to come to the table. The open door is still going to be there. The recreation center, the library, all the key facets of the community that support youth, we're all going to continue meeting and supporting them with our planning. But having a school-based healthcare center in the school that we can put out messages, we can work with the kids to plan them, we can respond proactively to things that they're seeing or emerging. It's just a great partnership. But one thing I do want to clear up as a former school board member is that the school-based healthcare center does not cost the taxpayer a dime. And we're so lucky in Ossining that a couple of years ago, the bond referendum was passed, and we were able to add a significant amount of space, a second floor to the science wing at the high school. And by doing that, we were able to utilize some space to bring a school-based healthcare center in. The only thing that it requires from the schools is a physical space.
Right.
But other than that,
Right.
the open door brings all the funding for it and brings a lot of opportunities beyond just preventing substance abuse, promoting healthy eating, promoting exercise, gardening.
Yeah, we do a lot of work with nutrition, not only in the schools, but teaching families, because we want the message carried out into the community. So we do a lot with healthy eating and healthy behaviors.
Do you work with the cafeterias in the schools? Do you?
We will be
Okay.
working with the cafeterias,
right.
yes. We work with the cafeterias in Portchester, and we will be working with the cafeterias in Ossining as well.
Right.
Yeah.
Now, when you say it's nestled away, you sit on the, well, I don't know if it's nestled away, it's on the second floor.
Well,
Do you-
actually, it's going to be
It's
on
going
the
to be on the
first floor.
first floor,
First floor.
yeah.
I was wondering, does it need to be in a more protected area for confidentiality
It needs
issues
to be
or
in a
not?
private area. We will have exam rooms. We'll be doing some minor work in the existing school nurse's office now. We'll be creating private exam room space. We'll be using, we have electronic health records at the open door. We'll be using the same electronic health records in the Ossining schools as well. So it's really protected. It's very confidential.
So how, again, going back to the school nurse, and having a facility, you know, I think of the school nurses when you're not feeling good, you go to the school nurse and then the decision is made whether you're sick or you're just trying to get out of class or whatever's going on. So the school nurse will continue the
Yes.
same role?
Yeah, I think I'm very excited about going into the high school first, because I think adolescents are really a tough age. But I'm especially excited in going into the Ossining schools because there's such seasoned nurses there. Ronnie Cunningham has been there for such a long time. And we'll really be learning from her as well about the school population and the kids. But the school nurse, Ronnie, will always be the first triage. So unless kids are not coming to us for a scheduled visit, so a scheduled physical or chronic disease management, planned care visit, they will always go through Ronnie, the school nurse, and she will make the decision. Does the child need to go home? Could the child go back to class? Or should she bring the child to the school-based health center? And we will collaborate with her. I mean, we collaborate with the school nurses. Ronnie will be part of the care team, care plan team. So it's very exciting.
Explain the situation like a strep throat, how that would work.
Right. Okay. So kids come down for sore throats, right, all the time. If the child we'll go to Ronnie first. If she'll look in the throat, she'll take the vital signs of the student. If the student has fever, she'll send the student down to the school-based health center. And because we're a licensed health center, we could do testing. So we will have our own little mini laboratory. So we'll be able to test that student right there and then for strep throat. If he or she does have strep throat, we will call the parent, let Ronnie know, of course, and our providers will call the prescription in right to the local pharmacy where the parent is affiliated with, and the parent needs to just pick up the prescription and start the student on
And the kid.
the student, yeah, and the kid, yeah, and the
This-
kid.
You know, we've had this issue in Albany about EpiPens
Yes.
and allergies, and in schools, you know, whether and this may relate to other things too, but can children carry their EpiPen to school? does the school or is the school nurse able to use it in emergency? If you have a school-based healthcare center, as you're proposing, is that kind of a non-issue then at that point?
It's a
that-
non-issue. We have EpiPens in our emergency box, as so does the school nurses. I believe they were all trained on using the EpiPen, all the school nurses and other various people in the school buildings. But yes, we also carry all those emergency medications, and we will respond to emergency situations in the school.
Right.
Yeah.
So let's go back. I just went to a meeting the other night in Cortland, and there have been a number of meetings lately about children overdosing on drugs, and you know, you can see the anxiety that parents have trying to get their kids through those teenage years, I guess, and early adulthood, but maybe even after that, and so on. So, Alice, how will these? Are there going to be people there in the healthcare center that are directly trained in dealing with kids that might be on drugs, or people are going to be called in? Or
Yeah, I could talk
what-
about that.
Okay.
I could address that, and then I'll give the floor to Alice. As part of our comprehensive physical, we always ask the questions: are you smoking? Are you taking drugs, illicit drugs? Are you drinking? So having a school-based health center is a real plus because we get to see the kids first.
Do you get an honest answer to those questions?
We feel we do. The kids are actually filling out these surveys themselves on an iPad.
Anonymously?
Anonymously. And also they do give their, because the provider does go over the information with the student. So we have, I think, first hand information to deal with that. So as honest as the student is, we have that issue, that information, which is important. And then our providers could then start with the process. Either a referral or they always start with doing some brief intervention counseling themselves and calling that student down and figuring out where they are on the continuum and involving the family. That's what it's about. It's really involving the family. It's a family issue.
Now, if there are other students in the schools that their parents haven't signed up to be a part of this program, is there any interaction with you all and them, or is that just precluded from you taking any action?
Oh, no,
at
no,
all?
no. Do you mean as far as educational programs?
Right.
or-
Yeah. If there was a child that came to school having had a lot of alcohol, for instance, and they're not a part of the school-based healthcare center. Do you get a referral at all, or does
Yes.
that stay with the nurse?
No, we would work, even if we do find a student who comes in inebriated, and usually the teachers will bring those students in. We would always involve the school personnel. The principal is always involved in
Right.
that. And they're really primarily responsible. It's their building.
Right. That's true.
Yeah.
So what are in Portchester, which is the greatest example, right?
Yes.
Of how well it's working. Are there more students that are involved in the healthcare center in the younger grades or the older grades, or?
No, it's very
you know?
interesting. We have the majority of the kids enrolled in our school-based health center in Portchester.
Okay.
So we have close to 90% of the kids enrolled. So
You said 90% before. I
so
think,
one
and I'm
way
thinking,
or
what is
another, they get
90%? My
enrolled. They
goodness.
might not start out enrolled, but once the parents hear about it and see firsthand, and the teachers promote it, and the school principals and the guidance counselors. So once they feel at ease and hear it from their school personnel, and the nurse is really important in promoting it. Most parents do sign their children up.
Alice, do you think that will happen in Ossining? That a good percentage, or is it going to work into it?
I think
or-
it's gonna take a little time. I think that we're very fortunate that you're filming this show to get the word out about how positive school-based healthcare centers can be, and I think that we'll slowly ease into it. I don't think we're going to get to those numbers initially, but I think that what's going to happen is kids have a way of spreading the word very
They
quickly, and the students that do access it, the word is going to get out, and then others are probably going to encourage their parents to sign them up. I think there's a tremendous need when Alette spoke about kids taking ownership of their healthcare situation. As teenagers progress from middle school into high school, I mean, you certainly don't go into the physical with your child, once they're above 12 or 13. And I think for kids to actually be in the driver's seat in some way, clearly decisions will be made with their parents. But for kids to be able to go and access a healthcare professional to ask a question, I know that we have a wonderful healthcare teacher. A wonderful health teacher at Ossining High School, Katie Doherty, and she's on your planning
she
committee.
is.
She gets asked a lot of questions from kids. So to have a team that that has confidentiality associated with it will be an enhancement. But I want to get back to your question about the heroin forums and the concerns about substance abuse in general, because in northern Westchester, which is part of your jurisdiction, there have been a number of kids, unfortunately, not kids, young adults, who have died from heroin overdoses. And clearly that's on the rise. You're hearing about it. The Today Show has had a series for the past 3 days this week on heroin and teens. And we're really seeing an increase in that because of prescription drug abuse. And keeping kids from taking prescription drugs is so critical. And in Ossining, through our Communities That Care grant, just recently we have a team of 8 students that learned how to do a multimedia training on prescription drug abuse for their peers.
Oh my goodness, that's
And
great.
they're actually the only students in Westchester who are trained to do this, and they've already done it in 8 health classes in the high school. So they've really become like peer educators on substance abuse prevention.
Right.
And by having a health care center in our district, we're going to be able to empower more students. We're going to do a Future Healthcare Leaders program this summer, which will be a 4-week program where kids will learn not just about healthcare in general, but they'll also learn about prevention and education of their peers with regard to substance abuse. So they're going to be real partners, peer partners with the healthcare center to get the word out about drug abuse.
Right.
But I also just
Very exciting.
yeah,
it
it's
is.
very
It's very
exciting.
exciting.
But I also want to, I want people to understand that in communities like Ossining and Portchester, in general, our teens, we have very strong no-use norms. It's directly really correlated to the to the socioeconomics of a community. And in Ossining, 68% of our teens, when they were surveyed, we do surveys every 2 years, and we just did one in November of 2013. 68% of our kids reported that they had not drunk anything in the past 30 days. So that's 2 out of
That's
3
great.
kids are not drinking.
Right.
And 82% of our kids are not smoking marijuana.
Right.
Those are very strong norms.
Those are very strong
Yeah,
numbers,
those-
and we
they
hope
are.
that everything that you're doing
are.
to develop these health centers in all of our schools, in the 2 schools anyway that we've heard about, but I'm assuming we can do many, many more. And I just want to thank you both for coming on the program today and educating all of us. And I'd like to thank those that are watching. Please, if you have any questions of our guests or me, just give me a call at 914-941-1111. Thank you very much for watching. Have a good evening. Thank you.